My peer, Maureen Heil, who is also at CHOP as a yoga therapist, she really loved that behavioral health area and she shines there. And I loved the oncology piece. And I still love that piece. So we're a consult service now, kind of like a palliative care team would be, or a physical therapist, where a frontline clinician, a physician, or an advanced practice provider will place a consult. For my team, the Integrative Oncology team, they'll place a consult for, you can do yoga therapy, massage therapy, or acupuncture, energy therapy. All three of us are practitioners of Reiki. And then we have some things that we're all also kind of cross-trained in that we can provide. But I have a list of patients. Our team tries to really kind of get in front and meet patients at diagnosis. And then we're really able to kind of follow them throughout their cancer journey. So I see kids both in the inpatient setting when they're in for an admission, whether that be a chemo admission, if it's a solid cancer, through surgery. And then also I get to see them in the outpatient setting when they're coming in for day appointments. And we follow them all the way through maintenance, or potentially through end of life. And I think with pediatrics, especially, it's really always changing, and kids are so incredibly resilient. I had a child earlier this week who was like, "I'm so nauseous, Tonia, what can I do?" And it's like, "Let's try our humming breath," and they pause, they may throw up, and they get right back into it. But I think that, the true space of yoga therapy within the pediatric setting, all of our practices can be therapeutic, but I have seen the most kind of, I don't want to say return on investment is not the right word I'm looking for, but the most kind of buyback and adherence to protocol with older adolescents. So 13, 14, 15 on through their 20s, because they get it and they see that these subtle practices give them back kind of a sense of control. And they're willing to do the work, which is just amazing.
It sounds like because they have the ability to see and connect the dots that these practices are actually helping,
Yeah.
that they can actually feel a bit of empowerment. Is
Yeah.
the yeah,
Yeah. Me too.
autonomy, like they can start going through and going, okay, these are the things that I can do to help the process that I'm going through.
Yes.
And those are some lifelong skills too, right?
Yeah. I mean, I think when you have a child that is ill, so much of their entire life is outside of their control, and
Hmm.
even outside of their parents or caregivers' control. And these practices give them back a sense of empowerment and resiliency. And it is also about the co-creation of goals. I'm not going in and saying, today we're going to work on this. It's
Hmm.
like, first, let's have a
Right.
conversation. And it could take weeks really to build relationship. And I think that's the other big piece about, our role as yoga therapists. Um, we're nervous system regulators. We are a comforting ear. We're a hand that you can hold. And, while we have a scope of practice, it's really, and I think I've seen this in my work, it's really about holding space for people to be able to just share what is happening right now. Especially in the hospital setting, they don't get that opportunity very often.